Good day. We will tell you about disease at the urinary system, namely urinary tract infection, examination and treatment on an outpatient basis, chronic kidney disease. Definition: urinary tract infection, a syndrome that includes clinically manifest acute infections on the upper and lower urinary tract, male genital organs, and asymptomatic bacteriuria. Next, pyelonephritis and non-specific infection disease with predominant damage to interstitial tissue in the P. cell system. Cystitis, inflammation of the mucosal membrane of the bladder, urethritis, inflammation of the urethra, and asymptomatic bacteriuria. Detection of bacteria and urine, 10 in 5 CFU in 1 milliliters of BU by microscopy without clinical and laboratory signs of urinary system disease. Epidemiology, UT, in the most common bacterial infection in the population. UT are the main cause of extragenital infections pathology in absentee practice among adult aged 20 to 50 years. UT are about 50 times more common in women, mainly cystitis or pyelonephritis. In men, majority UT in urethritis or prostatitis. Frequency includes of UT increase in patient more 50 years of age, but the ratio of women-men decrease due to use of the increasing incidence of prostate enlargement and in instrument procedures in men. Next, etiology of UT include a lot of agents. The main infection agents are E. coli and another infection agents. Pathogens include hematogens route, Staphylococcus aureus, Candida saprophyticus, and others. Maybe Mycobacterium, which primarily affect some other organ. Ascending paths, Escherichia coli and other members of the family Enterobacteriaceae. Next, pathogens of urinary tract infections, ascending spread of bacteria from the urethra, hematogenous route and lymphogenous route infections penetrate the kidney from a distant source of infection, pneumonia, sepsis, and etc.
So the UTI symptoms are frequent, strong urge to urinate, excretion of urine in small portions, pain, burning sensation when urinating, change in urine color, cloudy urine, flaky discharge in the urine, strong odor of urine, pain in the lower abdomen, pain in the lumbar region, increased body temperature, nausea, vomiting, Here is the differentiation between acute pyelonephritis and acute cystitis. So the main signs are the fever. In case of the acute pyelonephritis, the fever is about 38 degree and above. So intoxication is more pronounced in case of acute pyelonephritis. Pain in the lower back and stomach is present mostly in pyelonephritis. Dysuria is pronounced in case of acute cystitis. Leukocyturia is moderate to severe in case of pyelonephritis and usually moderate in case of cystitis. Erythrocyturia is pronounced in case of cystitis, and bacteriuria is pronounced and present in both cases. Here is the graph. It reflects the roads, how the causative agent can come to the kidneys, hematogenous way and ascending infection. Also, here you can see the mnemonics, FF chill DUF in pyelonephritis, F for flank pain, F for fever and chills, D for dysuria, U for urgency, and F for frequency. Also, there are some risk factors for acute pyelonephritis here in female. Short urethra, it's about the anatomical structure, urethra near anus, pregnancy, menopause, also some urinary stasis as benign prostate hyperplasia, stones, and cancer, and also some comorbid conditions such as congenital spinal injury, diabetes, and also some instrumentations such as cystoscopy and catheterization. So we've already mentioned them here. In both sexes, common risk factors are presence of bladder stone, urethral stricture, catheterization of the urinary tract, and diabetes mellitus. So the laboratory diagnosis of the UTI, general urine analysis, allows you to determine various properties of urine such as color, density, transparency, identify inflammatory changes in the organs of the urinary system, increasing quantity of the leukocytes in urine. The presence of bacteria and mucus is observed with infections of the urinary system. Next is urinalysis according to Nichikurenko. This analysis shows the exact amounts of red blood cells, leukocytes, and costs in the urine. The level of leukocytes indicates the severity of the inflammatory process. Next is culture of flora with determination of sensitivity to antibiotics. This study is of a great importance for the treatments of infectious disease. So it helps to identify the causative agent and also to choose the antibiotics that act specifically on this type of bacteria. Next is complete blood count, allows you to determine the number of red blood cells, platelets, leukocytes, and hemoglobin content. So the number of leukocytes increases during various inflammatory processes. Also, use blood for creatinine, urea, potassium, sodium, and calculation of the glomerular filtration rates. Next is chemical screening tests, such as urine dipstick. Rapid detects nitrites released by bacterial metabolism, and leukocyte esterase from inflammatory cells, which is not specific. Next is urine culture, which is important. We've mentioned that before. And quantitative culture, typical of UTI. A lower count is indicated of cystitis if the patient is symptomatic. So here are these types of laboratory analysis, urinalysis and its parameters. Instrumental diagnosis of UTI, ultrasound examination of the kidneys and bladder allows you to obtain images of internal organs, identify developmental disorders of the urinary system, kidney stones, and other changes. Computer tomography of the urinary system, obtaining accurate layer-by-layer images of internal organs is of great importance in determining the possible causes of infectious diseases of the urinary system. Next is intravenous urography, X-ray method for examining the urinary system. A special contrast agent is injected into a vein, then after a certain time, a series of X-ray are taken, which show the passage of this substance through the urinary system. At the same time, kidney function is assessed. Disorders in the structure of the urinary tract, kidney stones, and other diseases of the urinary system are identified. So some of the other additional research are cystoscopy. The method allows you to see the inner wall of the bladder and perform various manipulations. The next is about the UTI treatment. Here is the non-drug treatment. Starts with the drink plenty of fluid up to 2-3 liters per day to wash out microorganisms from the bladder, urinating every 2-3 hours and urinating before bed. Do not use baths with foam or chemical additives in the water. Cranberry fruit drink. Diet. And the diet, we should exclude of spicy, salty foods, sauces, seasonings, alcoholic beverages, chocolate, and coffee. Predominance is given for vegetables, fruits, and dairy products. Here is the classification of the chronic kidney disease by glomerular filtration rates. And there are 3 types of equations for the calculation of the GFR. The current criteria for CKD, kidney damage for 3 months or more, defined as structural or functional disorders, according to laboratory and instrumental research methods, with or without decrease in GFR. Preventing or slowing the progression of CKD. There are several measurements for the slowing the progression of CKD. First is specific therapy for underlying kidney disease may prevent or slow progression of CKD. Strict blood pressure control slows progression of CKD. Drugs that act on the renin-angiotensin-aldosterone system reduce proteinuria and slow the progression also. Intensive glycemic control slows the progression of albuminuria in diabetes. A low-protein diet slows the progression of CKD. And correction of phosphorus-calcium homeostasis slows down the progression of CKD. So when to start dialysis? According to the recommendations, dialysis should be started either when GFR decreases to less than 15 milliliters per minute or in the presence of the following conditions, such as symptoms of uremia, uncontrollable overhydration or hypertension with progressive deterioration of nutrition. In any case, dialysis should be started before the GFR drops to a level of 6 milliliters per minute, even with optimal pre-dialysis management of the patient and the absence of clinical manifestations of the disease. In high-risk patients, such as those with diabetes, earlier initiation of dialysis is preferable. So here is a mnemonics for acute indication for dialysis. A for acidosis, pH less than 7.1. E for electrolytes, refractory hyperkalemia. I for intoxication with substances such as alcohol, salicylates, lithium, etc. Overload, congestive heart failure, uremia, uremic pericarditis, uremic encephalopathy. So here is the mechanism of action of dialysis. So number 1 here in the graph, as you can see, this is fistule, which is connection between the artery and the vein, which is surgically made. And the second is actually pressure meter. The third is where the blood comes to the clearance. 4 is the pump, and 5th is the heparin pump. The 6th is a used dialysate, and the 7th is the fresh dialysate. 8th number is the isotonic solution. 9 is air catcher, so it prevents the air inside the blood. And 10 is already the clear blood. So let's come to the conclusion. The most common causes of bacterial UTIs and UTIs in general are Escherichia coli and other gram-negative intestinal bacteria. Asymptomatic bacteriuria does not require testing or treatment except in pregnant women, in immunocompromised patients, or before an invasive urologic procedure. Typically, urine culture is suspicious for complicated UTI, but not for uncomplicated cystitis. Patients should be assessed for anatomical abnormalities if the infection is recurrent or complicated, nephrolithiasis is suspected, or if infection is present painless gross hematuria, or sudden renal failure, as well as if fever persists for more than 72 hours. Whenever possible, consider the results of local susceptibility tests when choosing antibiotic therapy for UTI. Thanks for your attention.